In this episode of Medicine Across a Lifetime, let me ask you something straight away. When was the last time you really thought about how your patient's immune systems change with age? Not just in terms of flu shots or COVID-19 boosters, but the deeper shifts that affect how they respond to every infection and vaccination. It is easy to assume that older adults just need a shot and a checkup, but their immune resilience is far more nuanced, and overlooking it can have serious consequences. Imagine Margaret, 78, who walks daily, eats carefully, and engages socially. She is the picture of healthy aging, yet she ends up in the hospital with pneumonia. How did that happen? Because aging immune systems are subtle, complex, and often misunderstood. This is the world where physicians need to operate with more insight than ever before, balancing vaccination, lifestyle, and monitoring for post-viral syndromes. So, what exactly can we do in practice? First, vaccination remains the cornerstone. But it is not just about preventing infection, it is about preserving function, reducing inflammation, and supporting long-term immune resilience. Second, lifestyle interventions, sleep, nutrition, exercise, are not just nice-to-haves, they meaningfully enhance vaccine responses and recovery. And third, post-viral care is crucial. The fatigue, cognitive changes, and organ effects that linger after infection can silently erode quality of life if unrecognized. Now, here is a provocative question: how often do we, as clinicians, underestimate the lasting impact of viral infections in older adults? Too often, we treat the acute episode and move on. But the story does not end there. What if we had a framework to anticipate and mitigate these post-viral effects systematically? Imagine designing care plans that integrate vaccines, lifestyle, and follow-up. That is the future of geriatric immune care. It is not just theory. Research is showing us that shingles vaccination may reduce biological age markers, and targeted strategies for diseases like RSV and influenza can transform outcomes. Yet translating these findings into everyday practice requires awareness, vigilance, and a mindset shift. How do we integrate these lessons without overloading patients or staff? That is where thoughtful, evidence-based clinical judgment and clear communication come into play. So, what can you take away today? Think about your patient panels. Identify those whose immune resilience is at risk. Review vaccination history, support lifestyle changes, and establish follow-up for post-viral recovery. Start small, track outcomes, and share successes with colleagues. This is how thought leadership in medicine manifests, not in papers alone, but in real, actionable patient care. Before we end, I challenge you: what is one change you will implement this week to enhance your patient's immune health? Comment below, share this episode with your colleagues, and let us start a conversation that moves from theory into practice. Engage with your network, exchange insights, and raise your voice in shaping how older adults thrive under our care. That is it for today's episode of Medicine Across a Lifetime. I am Dr. Quan, and I invite you to step into this conversation, explore the insights, and take action to strengthen immune resilience in the patients you serve. Join us next time as we continue to examine the intersections of aging, immunity, and practical, evidence-based medicine.